The earliest form of medicine was the marriage of sharp objects and poor logic. Cavemen would cut holes in each other's heads so as to let room for the evil spirits to get out from, a practice strikingly similar to the modern lobotomy. How far have we really come? The symbol of the caduceus has been used to represent medicine since Roman times. This serpent-entwined staff was carried by Mercury, messenger of the gods, who would escort people to the underworld. This isn't as ironic as you might think, given that the practice of medicine has been plagued by misinformation and incompetence since the very beginning. Up until the medieval ages, the art of healing was resigned to placebos and guesswork. Then it got worse. Right after the fall of Rome, Europeans invented a time-saving technology of not bathing, casting a smelly, disease-ridden shadow across the whole continent. Scientists of the time were operating on untested theories based primarily on intuition. Because the Catholic Church forbid autopsy or surgery of any kind, doctors in the Dark Ages were flying blind. Some of the most popular medicines in the time included enemas, which was basically a turkey baster filled with a concoction of herbs and squirting it into the patient's anus, as well as bloodletting. The theory behind these practices was to reset the body's humoral balance, humors being the four liquids present in the body. Too much blood or sanguine would make the person hot-headed and irritable, or so the theory goes, whereas not enough would make them depressed and distant. The climate of ignorance leads to two extremes. Doctors would rob graves in the name of science, and doctors would make up treatments without any scientific community to challenge them. Before the stethoscope, nobody could be quite sure when a person had become a corpse, but the fear of being buried alive was very real. An example of the completely unsubstantiated nature of science was the method of telling whether a person was alive or not, which consisted of many steps including shocking the patient's nipples and pouring warm urine into their mouth. Even after the West crawled out of the Dark Ages, medicine was rarely more effective than no treatment at all. As recently as the Civil War, half of the casualties suffered by the army were a result of infection or incompetent surgery. The other half was gunshot wounds. After years of smallpox vaccinations in England, 7 children had died from the disease, whereas 72 had been killed during the vaccination process. Similar to the concept of vaccines, in the early 1900s, the idea that you could cure a lesser malady by subjecting the patient to something worse came to prominence. Doctors would often induce seizures in their patients with medicine, hoping to shake the crazy out of them. This treatment was based on the observation that patients were noticeably calmer after a seizure, even dead. So maybe it could calm down victims of mental illness such as schizophrenia, dementia, and depression. But with no systematic means of discrediting quacks, folk remedies and innocent intentions ravaged the health of countless people, especially Americans. Many people have heard that Coca-Cola was first intended as a way to make medicine taste better, and it had cocaine as an active ingredient. But Coke didn't invent the idea of medicinal narcotics. Cocaine toothache drops could be bought at any corner drugstore, as well as many other remedies, such as heroin cough syrup. They were so popular you could even buy them on airplanes. The problem was a world content with medicine that seemed plausible and required no proof except for superstition and word of mouth. Many prescriptions made intuitive sense but had no actual effect. In China, ground-up animal body parts associated with sexuality were sold as aphrodisiacs, such as snake penises and tiger testicles. Sadly enough, this is why tigers are currently on the endangered species list. It's easy to look back at the past and laugh at their humorous antics, but the tradition of misinformation is still carried like a blazing torch right up through the 1900s to the 21st century. Doctors tried everything from inducing comas to zapping patients with electricity to lobotomies in a half-assed attempt to cure their patients, again with good intentions. To emphasize how commonplace lobotomies had become, a doctor by the name of Walter Freeman used to drive around the country in what he called his lobotomobile, performing demonstrations in hospitals and homes on children as young as 13 for delinquent behavior and housewives who had lost their zeal for domestic work. Were these treatments effective? If you find zombies a valuable part of society, then yes. After the invention of penicillin in 1928, physicians all across the world jumped on the antibiotic bandwagon and overprescribed them to the clamoring masses. Bacteria were quickly able to adapt to our weaponry because of poor information on the doctor's part. Patients would start feeling better after a few doses of their antibiotics, and would stop taking them, then the resistant bacteria that hadn't been killed would basically be given a honeymoon. Our over-sanitized world has made our immune systems lazy. Problems such as allergies have been directly linked to our flabby immune systems, as the incidence of allergies is sharply lower in developing nations. But after all the borderline sadism of medicine throughout history, one disease stands out as the culprit for the vast majority of human suffering. That disease is human stupidity, or rather ignorance, or maybe even lack of education. We have come a long way in the pursuit of health, but as long as there are drugs with side effects worse than the symptoms they are intended to cure, as long as STDs ravage schools with abstinence-only curriculums, and as long as there are surgeons forgetting their tools in the bodies of patients they operate on, we will know that we have not come far enough. Education is the best medicine.